Thank you, Dr. FLOGEN, and ladies and gentlemen. Yes, hello. Yes, to tell the truth, this is the first time to present my practice on a congress because yes, my treatment is just under development, and yes, this presentation is surely a preliminary one, but the concept is so important, and I'm so happy to tell you. So innovative are treatments. And the first, please let me introduce my clinic. Yes, it's a small one, and the clinic is on the 4th floor of this building. And a small private clinic established in November 2018, and we are doing mainly anti-cancer immunotherapy for patients with cancer. And more than 80% of the patients, stage 4, are advanced cancers, are maybe terminal one, and it's very difficult. But yes, this year, University of Texas offered me to have a lecture for them because I successfully treated patients from Texas. The patients once given up by them, and this is the picture of her. And when she came to me 1 year ago, she was dying. Yes, this is the graph of the tumor marker of her, and the right image is the tumor. So giant liver metastasis there, and the tumor origin was pancreas. And in my, way, it's not a surprising thing to make her cure. Yes, this is the introduction. So the background, to take care of patients with 2 advanced cancer, yes, like him. The black spots, all cancers. And he was rejected by doctors. He visited so many tertiary centers, so famous one, Japanese National Cancer Institute, so many university hospitals, all of them are rejected to do treatments for him. How about her? Advanced cancers, breast cancers with multiple skin metastasis and lung metastasis and liver metastasis. And no doctors try to save her. How about him? He was told his life expectancy was at best only 2 weeks, and were told to go home and wait to die. And for them, clinical trials with randomized control study guidelines don't make any sense so far. Yes. As you know, yes, our immunotherapy is getting popular and popular because those 2 guys got Nobel Prize. Because they invented immune checkpoint inhibitor. But, yes, the doctors know the efficacy around 20%. Why? Yes, this is the homepage of the Dana-Farber, and they are looking for how to make cold tumors to hot tumors, but not sterilized. And this is the shame of that homepage. And the left blue is the blue one is a cold tumor. In the tumor, so many immunosuppressive cells, no cancer attacking cells. But right, hot tumor are T cells and other cancer just fighting. It's called hot tumor. So if we can have some ways to make cold tumor to hot tumor, that's fantastic. But still like a dream. But yes, I read this paper, intra-tumoral immunization to make cold tumor to hot tumor. Yes, the scheme is the same. Yes, dendritic cell is the antigen presenting cell. And I injected a dendritic cell into the tumor directly. And the dendritic cell recognized the cancer antigen and can transform the information of the cancer antigen to as many T cells as possible, and all of them can attack cancer cells. And this patient, yes, I injected dendritic cell into the metastasis cervical lymph nodes, and I used nivolumab, immune checkpoint inhibitor only, 0.3 milligram per kilogram. The dose is 1/10. It's the dose are so-called standard dose. And the tumor marker PSA was decreased to 0.3, and tumor all gone. Yes, and he is now so fine and no recurrence for 5 years. But I have to tell you the truth, yes, there is a big difference between a good responder and poor responder. What is the cause of such differences? I suffered from, yes, I didn't know, yes. And if, yes, I thought it should be genetically made up. But if it can be controlled, that's a good thing. So, yes, I suffered for almost 3 or 4 years to make it, yes, elucidate it. And I realized that, yes, levels of immunity control in our body, yes, consists molecular level, cellular level, tissue and organ level, body level. And we have to take care of all of them, but yes, the cellular immunoscape and gene mutation area aggressively developing. But innate immunity control and cancer microenvironment control has not still looked so heavily. But from my experience, controlling our innate immunity and cancer microenvironment is so important, so important. And I can tell you that, yes, this is the scheme. Yes, we are living while making balance between immune attack side and protect side. Yes. And the adaptive immunity had so much influence from innate immunity. So innate immunity, shifted to type 1, the attack side getting bigger and protective side getting smaller. And on the other hand, yes, the innate immunity shifted to type 2, the protective side getting bigger and attack side getting smaller. To make anti-cancer immunity so effective, we have to keep our innate immunity shifted to type 1 to make adaptive immunity, the attack side become big. And this is the exception, yes. From my experience, older patients are maybe around 90-year-old, the protective side spontaneously getting shrinked. So for us, it's comparatively easy to treat older patients more than at the age of 90 or so, as I will tell you later. Okay, and I have to tell you the importance of controlling cancer microenvironment. And yes, we have to think about the cancer immunoediting. Yes, before cancer grow, cancer control surrounding tissue and gathering the immunosuppressive cells to protect themselves, protect from immune attack. So they are making our barrier like circumstances. So in this situation, T cell, dendritic cell can't do their job. So controlling cancer microenvironment is inevitable. And we have found the way. And after that, yes, the cancer turned naked. Then, yes, the timing ready for attack. Yes, because the time is so limited, yeah, I have to tell you that, yes, the conclusion, yes. To make successful induction of cancer-specific CD, cytotoxic T cell, yes, without cytotoxic T cells, nothing happens. So, yes, but it's very important to proceed from A to D in order because, yes, there is a risk to induce immune tolerance to cancer cells if the procedure have not done this order. And yes, I can show you some example. Yes, this lady, 74-year-old female, she was suffered from intestinal malignant lymphoma. And she was going to die. And her abdomen so distended with the ascites, and she couldn't eat enough. And as you can see at the endoscopic view, there are so many tumors in the intestinal mucosa. And I gave her, yes, she brought me the data of 20 years, and I found something in that. And I thought, yes, to make her cure, only her need, she needs is to control her regulatory T cells. So what I did was to gave her 1 tablet a day, only 1 tablet a day, so cheap, so reasonable. And 1 month later, tumor all gone. This is the fact that yes, I didn't do anything to try to kill cancer cells. What I did was only controlling, adjusting her immunity. Okay. And this paper is very interesting title, The Dark Side of Immunotherapy. The dark side, yes. In short, the author insisted pancreas cancer is not an indication of the anti-cancer immunotherapy, although immunotherapy is getting popular and popular. But in my method, yes, this is a patient, 55-year-old female, pancreas cancer with peritoneal dissemination stage 4. And she came to me without any treatment. She denied to have standard chemotherapy. And yes, as a conclusion, yes, the tumor all gone in 2 months. Okay? How about her? How about her? Yes. I injected maybe skin metastasis, more than 10 sites. And there is some sickness, yes. I used some special cells which can secrete interferon gamma so much. And after 3 months later, yes, almost, yes, 90% of the tumor gone. That's the reality. And yes, I have to tell you the importance of, yes, increasing immunogenicity. Yes, in the textbook, so difficult one, but I can show you that. High immunogenicity means, yes, immune cells can detect the cells easily and respond easily and can recognize it as an enemy so easily. But the cell, if the cell is low immunity, no response, and ignore them. So we have to raise the immunogenicity of cancer cells before proceeding anti-cancer immunity, both drug or cell therapy. And this paper, yes, I found this paper is a radiation therapy and anti-tumor immunity, exposing immunogenic mutations to the immune system. Yes, radiation certainly can make immunogenicity of the tumors high. And in addition, yes, it's so interesting. Low-dose radiation can make immunogenicity high and immune response so high. So yes, I can show you the case of the liposarcoma. Liposarcoma is so famous tumor that yes, the only way to cure them is surgical removal. No chemotherapy effective, no radiation effective. And when he came to me, yes, the estimated tumor weight was around 30 kilogram. Yes, 2 weeks later, his abdomen started to shrink. Yes, even he was told his life expectancy was 2 weeks at best. 2 weeks later, and 1 week later from here, yes, he got normal. And first he came to me. He can hardly walk, but yes, 3 weeks later, he could play soccer with his son. He could play football with his little son. Okay, so, well, the time's so limited, yes. I have to insist again how important the order A to B, okay? And I can show you how. This is the case of the ovarian cancer, stage 4. And yes, as I told you, innate immunity control and cancer microenvironment control, the tumor marker getting decreased, low-dose radiation and cell injection. 3 months is enough, a little longer than I expected. The next case, small cell lung cancer. Yes, you can see a big tumor here and metastasis systemically. And yes, innate immunity control and cancer microenvironment control side. Tumor were getting decreased, and low-dose radiation and immune cells injection. 5 weeks is enough to make all cancer cells die. Okay. Yeah. So, yes. So far, the outcome, yes, 40 cases, yes, analyzed, and 31% CR, 55% PR, SD 2%, and PD 12%, and so response rate more than SD 88%. And that's my feeling. Positive factors, as I told you, older people, and no history of other treatments, and optimistic character. Negative factors, repeated surgery, repeated high-dose radiation, repeated cytotoxic, yes, chemotherapy. Allergic reaction to the drugs for immunomodulation, high-grade IRAD to checkpoint inhibitor, or GI tract, and pessimistic character. Okay, so yes, maybe if you understand what I'm talking about, is you can see what's going on. Yes, this is the case of the 92-year-old male diagnosed left maxillary sinus cancer. The tumor destruct the bone, upper jaw bone, and protrude to the oral cavity. And famous professor in a university hospital told his son, there's no way in the world, no possibility to cure him. He came to me just 1 week after the declaration, and I answered him, it's not so difficult, yes, because he is 92-year-old, so old guy. He didn't have any treatments, and his character is so optimistic. So I told him, yes, maybe I can do it better. Yes, and it's not so difficult. The son looked at me so suspiciously. But yes, I started innate immunity control, cancer microenvironment control, 2 weeks. 2 weeks later, tumor so shrinked. From here, yes, I started cell therapy just after low-dose radiation. 3 weeks later, almost all tumor gone, and he is still fine, although he was once declared, yes, his life expectancy was at best only 1 month, and go home and wait to die. Yes, I have to tell you, yes, I think so many doctors and researchers here, including, yes, Professor Toshikazu Yoshikawa. He is our senior director of my clinic. And I'm so thankful all of my staffs are. Thank you very much. Thank you for your attention.